Some of our nation's top health officials got the COVID vaccine today. Dr. Anthony Fauci, Health and Human Services Secretary Alex Azar, and National Institutes of Health Director Francis Collins all getting their first shots today. Dr. Fauci encouraging all Americans to do it too.
So many in our nation are saying, if Dr. Fauci gets the vaccine, I'm going to get the vaccine. So tell us a little bit of why it's important.
Well, for me, it's important for two reasons. One is that I'm an attending physician here on the staff at the National Institutes of Health Clinical Center, and so I do see patients. But as important or more important is as a symbol to the rest of the country that I feel extreme confidence in the safety and the efficacy of this vaccine, and I want to encourage everyone who has the opportunity to get vaccinated so that we could have a veil of protection over this country that would end this pandemic.
NBC News senior medical correspondent Dr. Torres joins me now. Dr. John, I'm not sure there's anything more comforting for Americans than seeing their very own beloved Dr. Fauci getting the coronavirus vaccine. Let's talk for a minute about this moment. I mean, 3 of our country's top health officials getting vaccinated today to build confidence in it. What a day.
This has been a great day, and what you're seeing are, these top health officials, the ones we've been trusting over the last 10 months to give us the accurate information, even in the midst of all the misinformation that's been going on out there. Dr. Fauci is probably the most trusted person in the country right now. So to see him get the shot, and he said at one point, he's going to get it once he realizes it's safe and once he believes it's effective. He got that shot. And a lot of Americans, I think, are looking at that going, okay, if he gets it, then I'm going to feel comfortable getting it as well. So I think that's really boosting people's confidence in the shot. On top of that, you see a couple other, Dr. Collins, Secretary Azar getting it as well. These are the ones that really push forward in the production of this Moderna vaccine. But you're also seeing politicians get it, people in the front lines getting it and saying, hey, it's not that bad. It's just a shot. And I think what we're going to see over the next couple of weeks are people getting it, not having reactions to it, and hopefully getting better or not getting COVID because of it. And I think that's going to boost the confidence across the country, Allison.
The other thing, Dr. John, I think so many of us love to hear, we've heard nurses and doctors saying, hey, it's not just you. We don't like getting shots either. Some of them are afraid of needles, even though they're in the medical profession, and they've come on TV and said, hey, it's okay. It's not that bad. I got this done, and you can too. What else do you think will help Americans, will comfort people who are on the fence and just aren't entirely comfortable here?
And Allison, I think what you're seeing again are these people that, the infectious disease doctors, the experts getting it. You're seeing politicians getting it. And I think that's going a long ways towards giving people more confidence. But I think the one step that's going to go even further are people having their friends get it. And once their friends starting getting it, the community starts getting it. And they realize that, hey, this is the tool we can use to open up our communities, to open up our country and get back to normal. Then I think more people will start jumping on the bandwagon and saying, hey, let's go ahead and start getting this. If you look at the surveys, a few months ago, not that many people were saying they get it. Now the majority of people are saying that they're going to get it, and I think that number is going to climb, especially, like I said, once you see people starting to get it, they say, hey, it really wasn't that big a deal. I really didn't notice anything out of it, and now I'm protected from coronavirus. I think that's when people will start opening their eyes and going, okay, it's time for me to get it too.
Yeah, if we start thinking, too, about all the things we might be able to do again, Dr. Torres, I know I'm just hanging on to the thought that I'm going to be able to go to a Yankee game again someday soon. That's what's getting me excited about getting the vaccine. Also today, Dr. Fauci was talking about this new COVID strain in the UK that people are pretty concerned about. Dr. Fauci saying it might already be here in the U.S. Listen to this.
When you have this amount of spread within a place like the UK, that you really need to assume that it's here already. It may not, and certainly is not the dominant strain, but I would not be surprised at all if it is already here.
What are your concerns, Dr. John, about this strain coming to the U.S.?
Don't be alarmed by what's going on there, but certainly be aware by what's going on there. And by that, what he means is right now, these are projections. These are estimates of what's happening and how infective this strain is. We've had other strains come across. As a matter of fact, from the original strains in Wuhan, the strain now is completely different, even the one dominant here in the United States. So this one in the UK, it's happening in a small part of the country, but it seems to be the predominant strain, and it seems to be more infectious. But again, a lot of seams going on here. We don't really know for sure. These are projections, and they're going to to look at it in much more detail. As far as the banning travel, to a certain extent, it's almost like closing the barn doors after the horse has already gotten out, because they've been looking at the strain since September. Travel has been going on since September. So more than likely, it's in other parts of the world as well. So shutting out that area, sure, using the barn analogy, it might keep the other horses in, but the horses that have gotten out are running wild at this point already. And so you need to focus on that to a certain extent. But again, like he said, this is not something to be alarmed about, but it's something to be aware about. And they're looking very, very hard at what this means and whether it means anything for us going forward, or whether it's just one of those changes that the viruses naturally take.
Dr. John, the CEO of BioNTech, that's the company that partnered with Pfizer on its COVID vaccine, says it is highly likely that the vaccine will still work on this new strain. Can you explain why he's so confident? Because so many of us might think, wait, how this is new. How could a vaccine possibly work on something new?
And it's new to a certain extent, Allison. What happens with these viruses, and this is what viruses do, they're constantly changing, but they're changing parts of the virus, not the entire virus, or not huge parts of it. Once they start changing huge parts of it, that's what they call a significant mutation, and that's when vaccines might not work. These are smaller mutations, smaller changes, and so for the most part, the virus is still the same. It might be able to attach to a cell a little easier, or it might be able to move about the body a little easier. That type of thing might happen, but as far as evading the vaccine, it doesn't look like it. And like you said, Pfizer said it looks like theirs is still going to protect against it. They're going to do some studies. Moderna is doing the same thing. And most experts are saying, yeah, it looks like we still should be good with these vaccines. But even if it seems to be changing or changes quick, it's not going to take long to change the vaccine because of the technology they're using.
Good to hear there. Dr. John, we got to talk about travel because a TSA spokesperson is saying that the agency has screened almost 1 million airline passengers yesterday. So here we are again. It's the holidays. People are ignoring advice from health officials. They are still traveling. What safety tips do you have for our viewers who still plan to travel or to get together with people that they do not live with over Christmas?
And, you know, Allison, you and I have talked about this, and we both get it. You know, people want to be with family and friends. And the big advice is to not travel, not to be with anybody who's not under your roof right now actively. But people are going to travel. So if you do travel, just take those extra precautions. Remember, the airplane itself is not that big of an issue. It's the airports before and after the airplane that can be the big issues. So make sure you social distance, make sure you wear a mask, wash your hands, those things that we always talk about. And when you're going to somebody's house, do the same things, whether it's a relative, whether it's a loved one or a friend. If it's somebody who has not been actively living under your roof for the past couple of weeks, treat them like you would treat strangers. Social distance, make sure you're wearing masks indoors, ventilate if you can. Those 4 W's we constantly talk about are things you're going to need to do as well. And then you have to remember, going back, you could be carrying it with you. So you have to be careful there as well. If you can get tested, great, get tested, but realize that the test itself, just because it's negative, doesn't mean you're necessarily negative. It might be that the test just isn't catching it right now. So all these precautions are important. We saw the big bump in cases after Thanksgiving. We're going to see a big bump in cases after this holiday season as well. Yeah. We don't want it to be any bigger than it is right now. So again, just taking those precautions. Sure, enjoy the holidays, but be safe, Allison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.